The timing and frequency of home pregnancy test use was not appreciably associated with maternal age, race, ethnicity, education, or income. However, an individual's prior obstetric history did significantly link with home pregnancy test behavior. Participants who had more children were more likely to be early testers. And while we don't know exactly what was motivating this, some of our the investigators and I have kind of hypothesized that maybe they recognize early symptoms of pregnancy before their counterparts who had not been pregnant before, and that motivated them to take an early test. We also saw that individuals who had a history of miscarriage, especially if that miscarriage was the most recent pregnancy outcome, were more likely to be very early and very frequent testers. A future direction of this work really does tie to that question that you had about anxiety and maternal mental health. We have excellent data on baseline maternal health, mental health, including self-reported anxiety and stress scores before and after these cycles. And our next step is to look to see whether or not any specific testing pattern is significantly associated with maternal anxiety or stress. That is a really big question, and I think that one that clinicians and epidemiologists will be increasingly faced with. I think that miscarriage is already an understudied topic, and as an epidemiologist, I'm all for collecting information at a more granular scale. So if we're able to know if a loss is what we consider a biochemical loss, or this positive than negative loss, or if it's the loss of a confirmed intrauterine pregnancy, I think that we should collect that information because it gives us more flexibility in the way that we understand and study it. Um, it is reasonable to think that very early losses may have different mechanisms or and a different set of risk factors than losses of confirmed intrauterine pregnancies with, fetal cardiac activity confirmed. And therefore, it makes sense to study them separately when we can. However, with epidemiologic studies, especially studies of miscarriage, there's a trade-off of what's ideal and what's feasible. So I fully support any robust and sound study of miscarriage. So that's also a really big question, and I do not think any guidelines should be born from one study alone. I really do hope that more people look at studies about pregnancy testing approaches and then their ramification, especially in different contexts. As I mentioned before, this study was only among people who were trying to conceive, so pregnancy planners, and we haven't looked at it in other groups who might have different motivations about why they test and what's valuable to them. For our future work, we are looking at maternal mental health and anxiety. And if we start to find strong ties with certain behaviors with post-cycle maternal mental health, then we might be able to start moving towards a should or towards a recommendation. Until then, I hope that this analysis sheds some light on some less considered aspects of pregnancy testing, because I believe that knowledge is power, and I hope that being able to weigh the benefits and drawbacks of different testing approaches empowers women to make informed decisions about testing that align with their values.